My mother suffered from migraines for many years, and luckily as she got older they went away. But seeing it firsthand, I know how debilitating this problem can be. Spinal cord stimulation has been a huge part of pain management since the early 90s. It went from just treating low back and leg pain to being used for neck and arm pain. We started looking at using stimulation not just for the spine itself, to actually where the nerves go, what we call peripheral nerve stimulation. So in layman's term, instead of putting the wire in a spine and stimulating the nerve where it starts, putting a wire under a skin and stimulating a nerve where it goes. I call this pre and postsynaptic stimulation. So getting it where it starts and getting it where it goes. How this relates to my recent article is stimulation has been looked at for chronic headache and migraine for many years. The original studies looking at stimulation for headaches only placed the wires underneath the base of the skull. The reason why these studies did not reach clinical significance, the reason why these studies did not do what they thought they would do, is that we were not treating headaches where they start. And as a neurologist, I know that headaches start in the brainstem. They actually start in the base of the neck and the base of our brain. So to me, the reason these wires were not controlling the headaches is we were treating headaches where they're going, not where they're starting. So with this theory in mind, I came up with a 4-lead array. So I placed the wires at the base of the skull, which was the original study, the original theory, but I also added 2 more wires which went into the epidural space in the neck, and I ran them as high as I could to get into the brainstem. Once these wires were close to the brainstem, they were able to transmit electricity into a part of the brainstem called the trigeminal nerve nucleus. Fancy word, but what it means is this is a part of the brainstem that controls the sensation of our face, the sensation of our head. And it is known that this is where migraines start. So the theory behind this array of leads is we sending electricity to this trigeminal nerve nucleus, and we're modulating or changing this abnormal electrical signal that leads to a migraine. By using this electricity, I'm able to break that abnormal electrical activity, and my patients now feel a pleasant sensation.